The state of Massachusetts is currently in crisis. There's an epidemic use of opiates among all our communities. Deaths from accidental opiate overdose is on the rise, and this phenomenon is no stranger to our community. Most people are unaware of how common opioid drug use is. Opiates are found in our medicine cabinets, in our children's schools, and on the streets. In the past 7 years, 70% of documented drug-related deaths in the city of Lowell were opiate-related. These numbers are on the rise. In 2009, there were 272 overdose calls to 911.
Unfortunately, it's becoming extremely common. In the years past, people that were experimenting with drugs, they would never consider experimenting with heroin. It was taboo. You know, they might snort a lot of cocaine, maybe do some marijuana or drink, but even, you know, older people in the generation say, oh my God, we never thought of heroin, you know. Those were the bad, taboo people. But because prescription medication is an opiate and it is a form of heroin, a lot of times people begin using prescription medication. Then what happens is an OxyContin pill, for example, and we hear about that all the time, is very expensive on the street. So once they get addicted, they discover that, hey, heroin's only $3 or $4 or $5 or $10 a bag, depending on where you get it, and they switch to heroin. So suddenly the taboo is no longer taboo.
Countless lives have been lost, and this is now a public health concern. In most cases, death could have been prevented. Being able to recognize an overdose can save someone's life.
Signs and symptoms for opiate overdoses are pinpoint pupils, the respiratory system starts to depress, and usually these patients are breathing less than 10 times a minute, which is not even close to adequate, and these patients are usually not conscious.
Even in the clinical setting, patients are still at risk for an overdose.
Well, our patients here, the higher risks would be high levels of alcohol use, mixing the drugs with other drugs, using the drugs alone.
Somebody who's overdosed in the past is extremely high risk. People are always looking to try to get that original high that they never find again. But because they keep trying to find it and they keep trying and trying and trying, they will overdose.
Opiate use has a major toll on all aspects of our community. The increased use of opiates across the state of Massachusetts has not only put burdens on healthcare systems, but has also increased the demands for prevention programs and community efforts.
We started with the grant. The research showed us that the people that were actually dying were white, middle-aged males, usually in the construction of the trade. We gather from that information that, you know, a roofer, for example, gets hurt, so he needs a prescription medication, but a lot of times people begin abusing it.
The Lowell Health Department specializes in educating the community of the harms of opiate use and preventative measures that can be taken. Only when responsible action is taken, overdoses can be prevented.
A lot of people that would be the first responders would be, if they're in a dorm room, would be the RAs, the EMTs, the police.
Usually the call comes in as an overdose, and we'll get there, we'll get on scene, and usually there's already somebody who knows that this person has overdosed, and the patient is most likely unconscious, and everything is starting to just shut down. Sometimes you can stimulate them with pain, which is usually just a sternal rub, which it's not really a comfortable thing, but usually maybe you'll get a little response out of them. Otherwise, these patients, they need to be ventilated, and we will administer drugs as necessary.
There are 8 pilot programs in the state of Massachusetts and there's information available on that as well. Anybody can become a Narcan responder nowadays. It used to be that just the doctors and the nurses and the EMTs, but because the overdose deaths have grown so high, as a matter of fact, 2 people a day in the state of Massachusetts die from an opioid overdose. They've made Narcan available to everyone. You become a Narcan responder. It's a nasal Narcan, it's not injectable. You go in, you get the training, they give you 2 nasal Narcans. If you use that Narcan, you go back, you tell them, they ask you what happened, because it's a pilot program, and then they'll give you 2 more Narcans.
From a social perspective, each and every person and organization of a community can help prevent and eliminate opiate obstacles and support those who have fallen to addiction, along with their loved ones that suffer.
There's also an organization that we started for the families of an addict, or for the families of somebody who's overdosed or is in that situation. That's called Learn to Cope.
Learn to Cope is a peer-led support group for parents and caregivers struggling with a member of their family who is addicted to opiates or other drugs. If you know anyone with an addiction to drugs, it's time to take action and get them help before they encounter a fatal overdose. For more information regarding opiates or other narcotics, call 978-970-4010, extension 4304.